Cognitive processing therapy is the current standard treatment for PTSD. It is highly effective on the population that it was created for, which is civilian victims of sexual assault. This treatment, however, is ineffective for veterans who suffer from combat-related PTSD. Despite this, CPT is still the treatment that veterans receive. Recent research suggests that unlike victims of sexual assault, the cause of veterans' PTSD is from a moral injury. Moral injury is caused when an individual participates in an action that goes against their pre-existing moral standards. Events like this are traumatizing and common in combat. Cognitive processing therapy is based on the idea that post-traumatic stress is caused by inaccurate beliefs about the traumatic event. For example, that it was the victim's fault that the assault happened in the first place. The post-traumatic stress combat veterans experience differs from victims of assault. In the case of veterans, guilt, shame, and anger can be caused by their intentional acts. It is unfortunate that in some cases, combat is the committing of planned acts, which would be unethical or illegal in any other context. Moral reassurance is what is commonly used in CPT as a method to change inaccurate beliefs about the event. For example, you would reassure them that they did the best they could, or that there is nothing they could have done. For veterans, this reassurance can feel disingenuous and usually does not provide them any relief. Instead, what is recommended for combat veterans is moral repair. This is based on accepting the difficult truths and repairing their damaged conscience. This new treatment that is now being introduced to specifically help veterans with moral injury is called adaptive disclosure. Adaptive disclosure focuses on helping the patient take ownership of the event and integrate the discomfort of the moral injury through experiencing forgiveness, self-compassion, and engaging in reparative behaviors. There are three guiding principles of adaptive disclosure. 1. Pain means hope. Guilt and shame are signs of an intact conscience. 2. Goodness is reclaimable with time. And 3. Forgiveness and repair are possible, no matter what the transgression. The preliminary work so far has demonstrated that adaptive disclosure is associated with large reductions in distress. A negative view of self can be rectified. Military personnel are satisfied and will recommend this treatment. Researchers are hopeful that this new treatment will greatly help a population so largely affected by PTSD.